Hello, my name is Alisa. Let's talk about depression.
What is depression? Depression is classified as a mood disorder. It may be described as feeling of sadness, loss, or anger that interferes with a person's everyday activities. People experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It can also influence relationship and some chronic health conditions. Conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. It's important to realize that feeling down at times is a normal part of life, that upsetting events happen to everyone, but if you're feeling down or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition that can get worse without proper treatment. Those who seek treatment often see improvement in symptoms in just a few weeks. Depression symptoms. Depression can be more than a constant state of sadness or feeling blue. Major depression can cause a variety of symptoms. Some affect your mood and after affect your body. Symptoms may be also be ongoing or come and go. The, the symptoms of depression can be experienced differently among men, women, and children differently. Depression causes. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include family history. You are at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Brain structure. There are greater risk for depression if the frontal of your brain is less active. However, scientists don't know if this happened before or after the onset of depressive symptoms. Medical condition. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder. Drug use. A history of drug or alcohol misuse can affect your risk. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical, personal history of mental illness, certain medications, stressful events such as loss of a loved one, economic problems, or a divorce. Depression test. There isn't a single test to diagnose depression, but your healthcare provider can make a diagnosis based on your symptoms and a psychological evaluation. In most cases, they'll ask a series of questions about your mood, appetite, sleep pattern, activity level, health, because depression can be linked to other health problem. Your healthcare provider may also conduct a physical examination and other blood work. Sometimes thyroid problems or a vitamin D deficiency can trigger symptoms of depression. Don't ignore symptoms of depression. If your mood doesn't improve or gets worse, seek medical help. Depression is a serious mental health illness with the potential for complication. If left untreated, complications can include weight gain or loss, physical pain, substance use problems, panic attacks, relationship problems, social isolation, thoughts of suicide, self-harm types of depression. Depression can be broken into categories depending on the severity of symptoms. Some people experience mild and temporary episodes, while others experience severe and ongoing depressive episodes. There are two main types: major depressive disorder and persistent depressive disorder. Major depressive disorder is the more severe form of depression. It characterized by persistent feeling of sadness, hopelessness, and worthlessness that don't go away on their own. In order to be diagnosed with clinical depression, you must experience 5 or more of the following symptoms over a 2-week period: feeling depressed most of the day, loss of interest is in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, slow thinking or movement, fatigue or low energy most days, feeling of worthlessness or guilt, loss of concentration or indecisiveness, recurring to thoughts or death or suicide. Persistent depressive disorder, used to be called dysthymia, is a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 weeks. Can affect your life more than major depression because it lasts for a longer period. It's common for people with persistent depressive disorder to lose interest in normal daily activities, feel hopeless, lack productivity, have low self-esteem. Depression can be treated successfully, but it's important to stick to your treatment plan. Medication: your healthcare provider may prescribe antidepressants, anti-anxiety, antipsychotic medication. Each type of medication that used to treat depression has benefits and potential risk. Psychotherapy: speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Light therapy: exposure to doses of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorder, which is now called major depressive disorder with a seasonal pattern. Alternative therapies: ask your healthcare provider about acupuncture of medication. Some herbal supplements are also used to treat depression, like John's-wort, thyme, and fish oil. Talk with your healthcare provider before taking a supplement or combining a supplement with prescription medication, because some supplements can react with certain medication. Some supplements may also worsen depression or reduce the effectiveness of medication. Exercise: aim for 20 minutes for physical activity 5 days a week. Exercise can increase your body's production of endorphins, which are the hormones that improve your mood. Avoid alcohol and drugs. Drinking or using drugs may make you feel better for a little bit, but in the long run, these substances can make depression and anxiety symptoms worse. Learn how to say no. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you feel better. Take care of yourself. You can also improve symptoms of depression by taking care of yourself. This included getting plenty of sleep, eating a healthy diet, avoiding negative people, or participating of enjoyable activities. Sometimes depression doesn't respond to medication. Your healthcare provider may recommend other treatment options if your symptoms don't improve. They include electroconvulsive therapy or repetitive tensile magnetic stimulation to treat depression and improve your mood. Preventing depression. Depression is generally considered to be preventable. It's hard to recognize what causes it, which means preventing it is more difficult. But once you experience a depressive episode, you may be better prepared to prevent a future episode by learning which lifestyle changes and treatment are helpful. Techniques that may help include regular exercise, getting plenty of sleep, managing treatments, reducing stress, building strong relationship with outer techniques and ideas may also help you prevent depression. Outlook for depression. Depression can be temporary or it can be a long-term challenge. Treatment doesn't always make your depression go away completely. However, treatment ought to make symptoms more manageable. Managing symptoms of depression involves finding the right combination of medication and therapies. If one treatment doesn't work, talk with your healthcare provider. They can help you create a different treatment plan that may work better in helping you manage your condition.
Thanks for watching. If you like this webinar, subscribe to the channel and like it. Goodbye.